Hello, friends. A very good day to all of you out there, and a very, very warm welcome from the entire team of our faith tutors. Yes, your mentors are here. Thank you so much for joining in. Hope my voice is audible to all of you out there. Hello, hello. Can you all hear me loud and clear? Thank you very much, Sarah, for this thumbs up, and thank you so much for this first step for MRCOG Part 1, January 2025. Thank you for having faith in our faith tutors, and a very, very warm welcome to all of you from all of us. Thank you so much. So my mentors are here. Few of them are in the clinic times, but we managed to have a good introduction. Hello, Safa. How are you doing today? Yes, my dearest, you're mute. So let's go on the unmute mode. So here we are. Thank you very much, Amani. Hello, Safa. Can you hear me?
Yes, ma'am.
Thank you very
Hello,
much.
dear
Thank you.
friends. Welcome you all.
Thank you so much. So here we go with the starting up. And we are here today to make you understand that what MRCOT Part 1 is all about and how we are going to take a start. Again, all the team is going to go with you guys hands in hands. You people will understand the sections of preparation. Oh, yes, warm welcome to this part. As compared to MRCOG 2 and 3, I always say that MRCOG Part 1 makes you go through it. The sailing is quite easy, but it's just that you need to understand if you're busy. You need to give the focused time to this preparation. And yes, the results are definitely going to be yours with the success. Thank you so much. So, what is the agenda for today? We are here meeting you guys. Why are we taking MRCOD Part 1? We should be knowing about the reasons for we have the aims for being in obstetrics and gynecology. What is the reason that we are taking? What are the prerequisites about preparation? What is the eligibility criteria for MRCOD Part 1? We should be knowing about the details further regarding the curriculum. How can I prepare for MRCOT Part 1 is a very, very important thing that's in all of you have this question today. If we hear about somebody not doing it in the first go, that makes us nervous. So why do students that fail in MRCOT Part 1 and how to make it in one go? So all these sections you're going to find today, all your questions would be answered today. So here we go, that why are we taking this MRCOT Part 1? Now, this membership Royal College of Obs and Gynae UK definitely is a prestigious degree, definitely has got a higher credibility. It makes you have a leadership in medical education and the competency level increases as well. Now, this is the first step that takes you towards a globally recognized qualification. We all have better standing when there is these alphabets MRCOG with our names, and that definitely improves your standing in your hospitals, in your workplace as well. Safa, what are the prerequisites for the Part 1 exam preparation? How they can be suitable, eligible for this, please? Yes, over to you.
Okay, ma'am. So, hello, my dear friends. First of all, you should make an account in the RCOG website. Okay, by giving your details. Okay. After that, you will be given one number. So that number remains as your membership number throughout your MRCOG journey. Okay. So you have to keep it, and then you have to send the eligibility for the approval, and at the same time you can send the expression of interest for the exam as well. Okay. So for RCOG account, you must have an account for the taking exams. Okay. If you have already booked or if you have already taken exam, then you have an account. Okay. That time there is no need for again making an account. Then about the submission of the application, you have to fill up the Part 1 eligibility application. Then you have to attach the following forms, like you have your original primary medical certificate. That one, you have to take the scan or copy of that, or you can send your medical registration certificate copy. Along with that, recently college has introduced another one, that is ID proof. This is because that so many mess are because of this mail ID discrepancy in the Pearson Center. So in the college website, it is given. This is the application form you have to fill up. You have to write your personal details and the medical qualification. In this, you should not write your post-graduation one. Only the primary degree, the MBBS, you have to write. Then this is the one I told. Just a minute. So this is the one they have mentioned recently. Like you have to submit the copy of your government issued ID. ID proof you have to submit in the eligibility itself. So that this ID you have to produce every time you write your exams, like for part 1, part 2, okay? So this one has been recently introduced by the college. Please take care of this. So all these three things, like your application form, then your medical certificates copy, then your government issued ID copy. All these things you have to make a mail and submit. Send this to the exam code, this mail ID. Okay. Any queries?
Did you guys understand that what is going to be the prerequisite? Amani, Hanan, Wigdan, Sarah, everyone, please. Did you guys understand that this is something which it's not only today, this is going to be for the next part. If you have your number already, you're going to take it forward from there. You should be memorizing that, or you should be knowing that this is what I've used earlier. Okay, Vigdan, that's perfect. Amani, that's great. You would be given that number, Sonali, once you do the registration, you will have your fixed number, like your roll number, right, Sonali? So you should know that this is your college number, and that would be with you in all your parts. And even in your results, Sonali, that would be written that Sonali, tick, 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 this college number has been, your result is going to be that has cleared MRCOG Part 1. Okay, so the college number is your identification. All right? Okay, yeah. So what are we aiming for, Safa? When is the next exam?
So next exam is on Tuesday, 21st January 2025. So the
Oh,
eligibility
yes.
deadline is September 6th. Before that, you have to send your eligibility. It is not the approval. Okay. And expression of interest is open right now. You all can submit your expression of interest even before the eligibility.
Mark the dates, everyone. Please mark the dates. Do not forget before 6th of September, you all have to send the eligibility for the exam, because you're going to get the emails only if you send the expression of interest. Do not forget that, please. Okay? All right. Sarah has a question, Safa. If I apply for the exam at 2020 and have eligibility number, is it necessary to do the eligibility number again?
There is no need for repeat eligibility. Once you are eligible, then there is no need to, again and again sending. But
Remember that
expression of interest,
eligibility, yes, every
expression
time.
of interest for every exam, but
Yes.
eligibility is once for life. That's it.
Eligibility is also once for life, please. Assessment of training is also once for life, please. If you have done assessment of training, if you have done the eligibility, it's not to be repeated. That can be utilized whenever you're ready to take the exam. All right? Okay. Yes, please continue, Safa.
Yes, ma'am. Hipai has a question how to get the college number. It just, in the RCOG website, just Google it and log in. In that first sign up account number making, you will have that make an account. You have to write your details like your name, address, everything. Okay, after that, they will give you one number. That will be the account number. Is it clear?
Yes, thank you. Yes.
Okay, ma'am. So the booking window is opening on 29th Tuesday. Surely we will be helping you how to book everything. Before that also we will have a session on about booking. Okay. Yes, Dr. Neha, you can send your expression of interest before eligibility as well.
Thank you very much. Dr. Kalai is here. Thank you very much. Good morning, Kalai. Happy to have you here. Thank you very much for taking care of the chat, sweetheart. Thank you. So your favorite mentor, Kalai would enjoy her session so much, and she'll be here to explain about certain subjects just in a bit. So, how do we prepare for MRCT Part 1? We have got modules, we have got sections, we have anatomy, we have embryology. You would have separate sessions from each module from different mentors, and you will have your assessment as well from the same modules. You've got physiology, you've got biochemistry, you've got endocrinology, the biostatistics, which you make it super easy for you guys. You have genetics, which Kalai would make it like ABC for you guys. You guys would love doing this. The feedbacks had been amazing after these sessions. You see tiny glimpse on our page for this, and the results are always spectacular. The hard work behind that. You have pharmacology, and when you will attend Safa's pharmacology, you would start loving all the medicines of the world. When you will see microbiology, you will start loving the mnemonics of all the microorganisms. The immunology, the biophysics with Kalai again is an amazing set. I'm super proud of these mentors, the way they make you memorize each and every part. And pathology, clinical management and data interpretation. You will find me myself making you understand. So what is the distribution of questions, Safa, and how important is each module? Because to start with, they should be super clear about what are those sections where they need to put an emphasis a little more.
So we have two papers. In paper 1, we have anatomy, biochemistry, embryology, endocrinology, and questions from biostatistics, genetics, and physiology. And paper 2, we have pharmacology, pathology, microbiology, immunobiophysics, and clinical management and data interpretation. So this is the exam format. It is a computer-based exam. You will have your exam in the Pearson Center. Okay, mostly the language of the exam is English, and there will be 2 papers. It is only a single best answers. You will given a question, and there will be a 4 or 5 options. Okay, so there is no negative marking at all for this exam. There will be 100 SBAs in the paper 1 and 100 SBAs in the paper 2.
Now, the
So
most important thing here, which we would like to tell you, is that it is not multiple choice questions, it's single based answer. When we say single based answer, that means that maybe A, B, C, D, E, A might not be wrong, C might not be wrong, E might be the best. So remember that you might have 2 options where you would be stuck up with that it is correct. So you need to get to the single best, right? So you might get appropriate answers, but out of them, the best answer needs to be clicked. And again, as we have mentioned, that there is no negative marking. So please make sure that you attempt all the questions. You can flag the questions which you want to review. And generally in MRCT Part 1, we never hear from the candidates that they are short of time. Time management is never a problem. Yes, please.
and they used to finish the exam before time itself.
Absolutely. Always we get phone calls and messages, ma'am, we are done. And I always call them, why didn't you revise them? Said, ma'am, I did revise 2 times. I checked everything 2 times. So still you have time remaining because it's a comparatively straightforward exam. Yes, so how is the distribution of timings? It's 2.5 hours plus 2.5 hours with a gap. And we will coach you guys at how to put in attention on the screens because this exam is not on paper. This is computer-based exam. So few of the students, they do have a trouble in having the screen focus. So in the end, we take the mock exams. We tell you guys that please, rather than reading your book, it's better that you do the single best answers on the screen so that if something is not in your hand, you are able to focus. So that gives you some time of maintaining focus and maintaining not to get exhausted during exam. And on the screen, picking up the buzzwords is essential. So this practice we would make you do in the last 2 months. So don't worry about that. All right, so this is how the Pearson Exam Center is. They are different in different parts of the world. Few are a little more comfortable, few are less comfortable. When you will do the booking, you will find all the guidance regarding the Pearson Center in your exam? At the moment, no, Neha, it's nothing like that. Lots and lots of groups are writing. We know about that. But at the moment, it's all the same until unless the college just makes any change. At the moment, it is SPA, Neha. All right. Okay, so Preeti is here or no, Safar? Are you going to take anatomy? Yes, please. So, how is the anatomy curriculum?
So anatomy is a very, very important subject because it carries 20 to 25 questions from the anatomy. So anatomy and embryo session is taken by Dr. Preeti. She is famous for anatomy. The sessions are very good. And mostly in anatomy, they will ask you for questions from the blood supply, mostly from the pelvis. Okay, related to pelvis, they will ask from the blood supply, nerve supply of the related to uterus, ovaries, and the pelvis, lymph nodes. Okay, and vulva, vagina, and cervix. Okay, then diagrams they will give, and from the diagrams they may ask you to identify that. So we have two anatomy sessions. After the two anatomy sessions, you will be super clear about the all the anatomy questions. Our students, they always feel confident about anatomy questions after the session. So anatomy is a very important subject, followed by embryology. This session as well taken by Dr. Preeti, and we will be covering all the important questions of this embryology so that you don't feel bored about embryology at all.
Preeti is here. All right, Preeti. How are you doing today? We have been missing you, girl. All
I'm
right.
sorry.
So I know it's a clinic time going on, sweetheart.
Yeah. Hello.
Yes.
Hello, everyone. Hello, ma'am.
Hello.
How are you doing?
Hi, sweetheart. We are good. So we were telling about anatomy that students they start loving anatomy when they do with Preeti, and they start loving about embryology when they do with Preeti. So what are the basic points of the anatomy and embryology? How you're going to make them understand and learn? It is said to be a volatile subject, but I'm glad that once they do with you, they've got a perfect memory. And after exam, we get messages. Preeti ma'am told this. Preeti ma'am made us learn this. So over to you, Preeti, for anatomy and embryology, please.
So, yeah, I can't put on the video. Uh, okay.
Okay.
So that's fine. So anatomy is actually a very easy subject, and you need not worry about it at all. I will be giving you loads of mnemonics for each and every section. So there are certain sections that we have, like in the topics we have the pelvic bones, then we have the a fetal skull. These are very standard questions. Then we have the blood supply of the pelvis, the branches of the aorta, and each and every topic when we cover, you will come to know that we do it in a very systematic way. And I give you mnemonics to quickly remember the answer. See, everybody knows the answer. But what happens when you see the paper in the exam? Suddenly you see four options and you get confused. To prevent that from happening, we have the mnemonics. It's not like you don't know the answers. You know the answers. As an answer, when you see in practicals, you might be knowing it. So these mnemonics help you to overcome that last minute exam stress. And for a better understanding, I also put videos in your class so that, if any particular topic is a three-dimensional orientation and it's not coming clear to you, I've put videos so that once you see that video, you will not forget anything, about it. Then there is also like the femoral triangle, abdominal wall, the muscles of the pelvis, perineum, the blood supply. So we all do it with picture questions so that it has a very good memory. And once anatomy is done, anatomy and embryology, I really used to love these subjects, and they are completely, they are linked with each other. Like how the body
Absolutely.
has
Yeah.
developed, it's because of that the anatomy is that way. So the
Absolutely.
embryology, once you do anatomy and then you do embryology, then you figure out, oh, this has developed, the heart has gone here because it was forming in this way, and that's why the anatomy is like this. So once you do anatomy and you do embryology close to it within a few days, the memory becomes very clear. And even for embryology, we do lots of mnemonics. And it's like a mathematical subject. You just remember it in sequence and you'll not forget. There's nothing to go wrong about it.
Yeah, so we can
So
go to embryology, Safa, the next one. The bulk of the questions are from anatomy, friends. And as Preeti is saying, if your anatomy is strong, it's just like 2 plus 2 is 4. So I always say that lots of things they get changed. Even pharmacology can get updated, but anatomy is something that stays the same in the medical school. I mean, when we became doctors, or I think when our generations would come with anatomy and embryo is something that cannot change because that makes our basis. Rest of the subjects, they can get updated, the guidelines can get updated. Having a good grip of anatomy is very important for all the subjects. I always say, may that be physiology. If you remember and understand the anatomy of the heart, yes, you're superb in physiology. If you learn the basics better, you're going to be good in all the subjects. So, Preeti makes the skeleton and the basis of the MRCOG Part 1 course. And thank you very much for all these efforts. Thank you very much, Preeti, for being here today. Thank you. Microbiology, what is it for and how are you going to cover, Safa?
So regarding microbiology, there will be asking questions around 15 to 20 questions,
20.
and these are very important. We'll be teaching completely about microbiology with the good mnemonics so that, it will be in your mind throughout your life. Okay, even in part 2 also, I used to see students telling the mnemonics which we told in the part 1.
Part 1, absolutely.
Yeah.
When you guys come to me in part 2, and when I teach about certain topics, especially the BASH guidelines, we are talking about the chlamydia, we're talking about pelvic inflammatory disease, and they said, yes, ma'am, in MRCG part 1, we learned this way, and you've got a very strong basis to do the recommendation. So this MRCG part 1 being strong in that makes your part 2 and part 3 bases also very strong. So keep in mind, it's not a matter of this exam, it's actually a basis of the next exam as well. Immunology. You got Kala here?
So in immunology, you will have 5 to 7 questions, and mostly they will ask about types of immunity, then hypersensitivity reactions, and the cells. So there will be the session will be covering whatever covered in the session will be sufficient to attend all those 5 to 7 questions.
And the slides and the session would be absolutely sufficient. And then you can just have to practice the questions because we make it in a way that nothing is left for your preparation and that makes you skilled and saves your time as well. Just not searching everywhere that, what do you have to do from immunology? Okay. All right. So, yes,
All right,
biochemistry.
biochemistry, I used to take biochemistry. So this will be very, very vast subject. But after my session, I used to give so many mnemonics for the students. So they are very happy with this. Hope this batch also will tell the same, ma'am.
Absolutely. So for me, if you ask me, I always run away from this aerobic, anaerobic, this Krebs cycle, and so many things. I mean, I was like the person who runs away. But when I see students loving biochemistry and they love these sessions, which are very, very dry, I feel proud of the students as well, and of course my mentors, my team as well, that they make it interesting. They make it in a way that you start solving them as riddles. So that is the aim, that you do not just attend the session, that makes you part of your memory. And after session, 80% of the topic is on your on your tip. So that's basically the major point. Pharmacology is always very volatile, but I am glad that again the mnemonics are amazing and that helps you in the next part as well. It is important. 20 to 25 questions makes so much in your exam. And let me tell you that if something is students are forgetting, that is pharma. That's something which we all tend to forget and needs more revision after anatomy. Pharmacology is a second volatile subject, but I'm sure that after sessions you'll feel very good, confident in the pharmacology subject.
Yeah. So regarding that form of biochemistry, physio, and anatomy, it's not changing. So we recommend to read from the essential revision guide. But when concerning about pharmacology, we can't say because this book is not updated one. So we used to give in the session updated guidelines, updated talk articles, information from the talk articles and the strategy. So the pharmacology session will be covering all those recent drugs, mechanism of action, side effects of the drugs used in the gynecological practice and the obstetric practice. And this is a very, very important subject as well, because in paper 2, this subject carries literally 20 to 25 questions.
And again, the difficulty level in pharmacology is not that it's not known. The difficulty level is that students, they pick up old recommendations, old guidelines. For example, there have been, because of resistance, so many medications that are not being used. If you're using the old medications, which are now not part of the recommendations in UK, you're going wrong. So this part requires the updated information. We go even to the TOG articles, we go to the recent Green Top guidelines, the recent NICE guidelines, so that you know that what is recommended today. The ones who are not reading the recent updated, they might go wrong in certain questions, because 2 to 3 questions definitely come from the updated data from pharmacology. Coming to the pathology.
Pathology, mostly we cover general pathology and benign gynecological pathology and the cancers, malignancies. So all those important topics from the pathology, we will be covering from statology mostly, and then from the guidelines. And guidelines, particularly, FIGO guidelines, staging of cancers and all. From FIGO guidelines, we will be covering.
Yes, please.
And this is again an important subject as well, because it carries literally 15 to 20 questions. But there can be some overlapping between the pathology and the clinical interpretation. The questions will be coming here as well or coming there as well. But in pathology,
Absolutely.
we make
When I
sure that
take the clinical and data interpretation and the investigations come, so often just picking up the answers from the investigations, they make us understand about what pathology is there. So slight overlapping is there, but we make you prepare in a way that if any question has come, like interpretation of any investigation is there, you can correlate that to the symptoms of that condition and disease. So we would definitely help you in that as well.
So now Dr. Kalai will tell about physio.
Yes. Hello,
Everyone.
Kalai. How are you doing? Good
Hello,
morning.
Kalai
Good
dear.
morning.
Hi,
How are
ma'am.
you?
Hi, Dr. Safa. I'm good. Thank you.
Thank you so much. Thank you. So, sweetheart, about physiology, biophysics, your topics and genetics, please guide them that how they're going to be and what should they be expecting from physiology.
Oh, ma'am. Thank you, ma'am. Hi, everyone. I'm happy to interact with you all. So I'm going to cover physiology, endocrinology, genetics, and then biophysics. And physiology, you will get 10 to 15 questions. And so I will make all the subjects as interesting as possible. So it's very important to do the target reading whenever you are preparing for the MRCOG exams. And it's very important to love your reading as well. Okay. So whenever we prepare for the exams, like we really enjoy the preparation. So it's very important to enjoy your preparation as well. So in the physiology, mainly we have to concentrate about male and then female reproductive system and what are the physiological changes happens at the time of the pregnancy and then fetal physiology. So these are the major 4 areas where the questions will be focused. So at the end of the session, so you will be so clear about this and then you will be able to answer all the questions related to the physiology. Can I have the next slide, please? Okay, endocrinology is also one of the major subject, and so you will be having 10 to 15 questions from the endocrinology, and believe me, endocrinology is the most interesting subject. Okay, so most of the time the questions will be targeted in the adrenal gland, and after that it will be pituitary and then thyroid glands. So they will ask you like, what is the condition, which hormone is excessive, what are the symptoms, what is the diagnosis, what is the screening test at the end of the session. So I will be making some tables so that it will be easy for you to revise. And they can ask you regarding the placental structure and then function. So these are some of the important topics which we have to cover in the endocrinology. and with a nice tables, and then at the end of the session, so it will be easy for you all to understand. And regarding the genetics and then biophysics, these are the small subject, but most of the students, they find it very, very difficult because it's very hard to understand. So during the genetics and then biophysics session, okay, so I will make a lot of effort to make you people understand very clearly so that you need not to memorize what it is. And you will be getting around 10 questions from the genetics. So most of the time there will be a pedigree analysis, and so they will be asking about the inheritance pattern, single gene disorders. So these are the from the genetics. And then biophysics. Again, the biophysics is also a small subject but a difficult subject. So 20 to 25 questions will be there from the biophysics, and mostly the questions will be from the electrosurgery. And apart from that, they will be asking you the questions from the CTG and the investigations which used in the medical practice like ultrasound, MRA. What is the basics behind this? So these everything will be the from the biophysics, and so definitely you will be feel the difference, the students who attend the sessions and then who the students who didn't attend the sessions, because the students who are preparing on their own, they will find it very difficult from the genetics and then biophysics, but the students who are taking the course, they will find it very easy. And these are from my side, and then I'm so happy to meet you all soon. Thank you.
Thank you so much. Thank you, Kil. I am super proud of you, and students are anxiously waiting that you start taking the session. So see you in the study group soon. Thank you so much, my love. Thank you.
Thank you, ma'am.
All right, so data interpretation is difficult for few of the students, the ones who basically have not had the clinical practice. There are a few students who have just had their 1 year foundation, yeah, and they just start doing the MRCOG Part 1 preparation. So they're not very familiar with cardiotocographies. They're not very familiar with the investigations of infections and diagnosis. You don't have to worry about this. We are famous for making you learn the urodynamic charts. We are famous to make you learn the CTG. We are famous to make you learn about all the clinical and data interpretation. I will be responsible myself for that. I am responsible for the entire course though, but this one subject, you will find me in the live session, and we would be interacting on this particular topic as well. Biostatistics again. Our gold medalist RCOG takes that for you guys, students. They love it like anything. She makes sure that she makes it your strength and beautifully covers biostats. The students in the past, they start loving biostatistics. And if you have any doubt in biostats, she has a wonderful way of teaching, and I'm sure that you guys would love biostats, both in MRCOG Part 1 and Part 2 as well. So this was the curriculum. Now, Safa would tell you specifically the books, because there are a few books which are not very much updated, and there we feel difficulty. But revision notes always stays revision notes for MRCOG Part 1. So Safa, if you could guide them, because this is the
Yes, ma'am.
basic query, because they are taking the first step today.
So there are few books are available, okay, but the recent updated books are not there. Revision notes, then essential revision guide is the one which is the always a very good reference. Okay,
Absolutely.
so these are the
Yeah.
SDA books like Catherine, then this Andrew, okay, then Richa Saxena. Okay, all the materials are available in our channels. Okay, once you registered for the paid course, you will be given the access to the channels. You can have them as a printout as well, or you can read in the PDF. Okay, now it's ma'am will be telling you what is the problem and what is
Okay.
the solution.
So now the most important thing, which I want to tell all of you out there, is the first thing to start up is that please make a target that when am I taking MRCOG 1? If you've aimed MRCOG 1 January 2025, let me tell you guys that there is, without any hesitation, 100% you can pass and clear this exam in one go. Again, it's an entrance exam. So whenever the exam is taken to be an entrance one, definitely the ease is more as compared to part two and part three. The students who still, the percentage is very less, but students who still can't make an MRCOT part one are shaky. They do not have any focused preparation. They do have the exam stress, like they don't have a good strategy for making up their minds for taking MRCOT part one. Absolutely, Neha. Everything would be guided that what do you have to do from here. So what are the solutions for these problems? The solution is being very confident, making your aim, finding that right thing that, okay, now I am taking this exam. This is my schedule. I would be focused. I would resolve every single problem which would come my way. I would do that with the hospital routine. I will have a very targeted approach and I would give the specific time needed for every single part and judiciously prepare despite all the odds. Will give my best for this preparation. This mindset is needed and I guarantee you success if you study. I've seen students studying for MRCAT Part 1. You would not believe, just maybe 20 days, 25 days. I still remember Rawat messaging from UK. It's 20 days remaining. I've just decided for MRCT Part 1 and I'm telling, okay, so do you have time? He said, yes. So I said, just do it. And I have students who have passed in like 20 days, 25 days, 2 months, 3 months. MRCT Part 1 is doable. So for now, Sayeda, absolutely. See, Preeti says I did it in 40 days. So I myself did it, I think, 45 days MRCOT Part 1. The things are different in MRCOT Part 2, but for Part 1, yes, it's doable in this much time. How much time daily we need to give? So Sayeda, you are going to do daily Ala's discussion because we go in a set pattern. Maybe you guys don't understand. Maybe you think that, randomly moderator is coming and she's just posting. The things are not like this. We have a solid back end meeting. We have a solid back end target making for ourselves because we have passed through the same path which you are passing today. So what we do is that we make targets that this much is to be covered today. So moderator knows that she has to do this. Now Ala knows that today she has to cover this much question, then she has to cover this much question. And eventually after 2 months, she has to come back to this for reinforcement. If you follow our open group and the paid premium group, nothing would be left and you would do at least 3 to 4 revisions of the entire curriculum. When you start taking the live session, you'll feel the change. That is the reason that we approach almost 100% results. And last time, I would like to tell you that we ourselves broke all the records of RFA. 98% was the topper. And now she is with me in MRCPI and MRCOG2 course. Rizu, you must have seen her in the Facebook page as well. You must have seen in different mock exams coming as role player. She scored 98%, which was a record score. But let me tell you, nothing but the daily schedule following. Daily schedule following. If you guys follow the daily schedule, you don't need anything, Sayeda, right? So daily meeting, if you can't do that at that time, you're in the hospital, it's absolutely okay. You guys can do it after you get free. I mean, just scroll the topic and you people will start absorbing the things. The mistakes you do, start writing them down and come back to it before sleeping and you people would not have any difficulty in clearing this exam in one go. For you guys, first time ever, we are starting this course earlier. So generally we used to start somewhere in August, but this time to add on another 15 days of rapid revision, we have commenced this course earlier. And that again was a meeting with all the heads and brilliant brains sitting together that how we can make it more fruitful. And the results we had is, okay, 15 days before, and we are going to give another revision of 15 days just to again achieve our 100% results. Thank you so much. I hope you guys are enthusiastic in studying. I hope you guys do not have any confusion in how you have to take MRCOG Part 1 as a success. It's doable. Just give your 100%. We would be with you guys. You will feel the change. Right? Now, the question which you guys want to know about the tips and tricks that how we're going to make our day. So if I give them an outline that how basically they should be revising, don't leave the live sessions, please. Make sure that you make notes out of them. Practice the recall questions, exam important questions, which definitely the moderator would do with you guys, and keep on writing your confusion questions, which we would do in the end with you guys. All right? Yes?
Yes, ma'am. So, Dr. Neha has a question about our website. So, in our
Yep.
website, you have all the important notes for each subject. Okay, you can go through that. And then second thing, very important thing is that there is a images folder. So in part 1 exam, they ask many questions about the images. They will give an image and they will ask interpretation or what is the diagnosis. Okay. So images folder, you have to see frequently so that it will get imprint on your mind. Okay. And third thing is that we have question pools of all the subjects, literally 200 questions. It is from the all the possible sources of the books. Okay. So you can go through that. And now this time we are going to add one more thing in our website, that post-session assessment. Like after every subject, you will have a mock test on that particular test, particular subject alone. It will be around 30 questions from the subject. Okay. This will be in the website. And live session recordings. Most of the time, live sessions on Sundays. If you are not able to attend the live session, the recordings will be available in the website till your January exam. Neha, is it clear, my dear? Is it clear? Okay. So
Absolutely.
for the preparation, you just need to spend 1 hour in the premium group, and that is paid group, and 1 hour in the open group. Okay, in open group, Dr. Ala will be discussing the past papers, and the premium group, we will be doing questions from the all the sources regarding the subject. Like for example, now we are starting anatomy from tomorrow. From the anatomy questions from all the possible courses, our moderator Dr. Sarah will be posting. So there is no need that you have to read then only come to the session. You learn in the session itself. Today you are learning this point. Tomorrow when they are repeating the same question, you have to answer. If you are forgetting tomorrow, day after tomorrow, they will post. When they post that, you will be remembering that. So it is by only repeated practice. If you start your preparation from today, it will be easy one to pass with high scores for January 2025 exam. Okay. So
Great.
only
All right.
repeated practice.
Okay, so what are the course features, Safa, how it's going to go ahead?
Yeah, just now I told about. So we have the live session. It's covering almost all the subjects. There will be 2 live sessions, 15 live sessions, and biostatistics, including biostatistics. And in the website, you have question pool, and you will have a post-session assessment mock test as well. Okay. So we have a separate group on biostatistics. It will be formed near exam. Like for example, for January exam, we will have it in October. We will have a daily practice of biostatistics questions. We will make you a strong. We will make you will be a master in statistics after this.
All right. So we just wanted to give you this hope, and we just wanted to tell you that last time when we were taking the sessions, there was so many students who started as just they didn't have time. They started with baby steps, and wonderful feedbacks had been there again. Our aim is not giving you just a lecture and just making you speak about the topic. It's about that your memory is better. It's about that you're able to solve the question. And if you are able to solve the question that gives us the final best answer to what efforts which we are making up, and the results are again, they're showing the same. So we have been putting so much of an hard work in making up your memory. What we need is continuity, and we need is just the hard work of just following the daily schedule, and that would do the job. Yes. So it's not about that today you guys are blank. Everybody who is starting is feeling the same. It is that gradually when we just move ahead, the things which we are doing today, they should be on our tips, and the things which we have already done, we should keep on revising that. That makes the change. All right. So please, lots and lots of, if you go to the display picture, there's so many students. Last time we crossed like 100 plus, and we are expecting the same results this time. Please do not miss out the live sessions. Do not miss out the daily discussion. We would make you have 3 to 4 revisions, and you would feel the change with every passing day in your preparation, please.
This is our live session schedule. Already we have posted this in our Telegram group as well as in the website as well. And this is the daily topic, daily practice session schedule. Okay. Do you have any doubts in this? Okay, those who want to join.
Thank you very
Today
much.
we
Notes in this
have
website. Yes, yes, Aksa. Yes, that is absolutely enough. Absolutely enough. Right? The ones who are messaging back to back that because we are starting earlier, people wanted to join in August. We are starting again for the 4th revision. We have preponed course 15 days earlier so that you don't miss out the final revision, please. You people can put in the coupon here. You go to the link of MRCT Part 1 Premium January 2025, and you go to the coupon section. Safa, next, please. When you put the coupon there, it is going to reduce the price, and please make sure that you just do the checkout after validating the coupon. That is 50M1RFA. I repeat, 50M1RFA. Validate and then check out for having this coupon for 72 hours. So all those who are mentioning about this, thank you so much. Go ahead and then just do the checkout. Thank you very much. We are here for any questions, please. I'm happy to take the questions. If anything you want to ask, we're going to see you guys with lots of motivation in the study group. Who is going to pass the exam in January 2025? Can I have the thumbs up? Can I have those smiling faces who are aiming? Aksa is going to pass. That's lovely. Okay, Sayeda is going to pass. That's amazing. Firdosa Yusuf is going to pass. That is so good. You all are the best. It's just that you people are entering into a journey where we just need hands in hands of family support, and you people would, okay, Hipai is also going to pass. I'm sure that you all would be successful. It's just Neha, a one step and the baby steps. Sarah, thank you very much. I am so grateful that you're clear today and you loved it. Fauzia Ibrahim, you would see the change once you'll be in a study group. RFA is a family, RFA is togetherness, RFA is a helping hand, and this is what we believe. This is what we promote and we motivate students for. Thank you so much. Any questions, any comments, anything you guys want us to repeat? We are here for you guys, and we are going to see you guys in the study group. Any question, please? Any question?
You can open up your mic and ask as well.
Yes, please. If anything regarding preparation, thank you very much, Al-Fateh. I'm sure you're going to be on the champion board. Absolutely. Yes. Anything? All right. Okay. All right, Safa, some final words. Thank you very much, Mr. Jaha. We are pleased to have you here. Thank you so much. Thank you. All right, so in the study group, we are having the daily discussions, and the moderator is going to tell you. Thank you very much, Vigdan Ali Barik. We are happy to have you here. Thank you so much, By my pleasure. The last word, Safa. So before we call it a day.
Any doubts?
Any doubts? Any questions?
Okay, friends, you all will enjoy the sessions.
Thank
This
you
would be
so
a
much.
memorable one.
Thank you so much. Thank you. All right, friends. So see you guys in the study group. We are grateful for this love. We again say for you guys, this might be just another study group for us. Again, it's passion, it's hard work, and it's an aim that you all have to be successful. So I do not want one student, two students, three students. I want a family to be successful, hands in hands, help each other, and make it a success. Thank you very much. I love you all. Take very good care. Thank you very much, Preeti, Kalai. Thank you very much, Rini. Thank you very much, Safa. Thank you very much, back in team. And here we are, starting another journey with a smile, with a happy heart. We would face ups and downs in this journey. There would be day when we'll have free time, and there would be day when we'll not have free time. But still, we'll have a smile on our face, and we will make it a success together. Thank you very much. Bye-bye from RFA team. We will see you guys in
Thank
the
you,
study
everyone.
group. Thank you. Bye-bye, everyone. Thank you so much. Thank you.